All right. Well, here we are, Renee. I think we're doing this a little differently today, aren't we?
Yeah, we're in two different locations, two different states. What is going on with you?
I am actually in Maryland, at the Maryland Rural Health Association conference, learning about rural health on the East Coast.
Oh,
So
that
I
sounds
think there's
fun.
going to be a lot to talk about.
Yeah, I can't wait. Before we get started, though, what's happening on the farm while you're in Maryland this week?
Well, I'm thinking about tax season, right? We talk about stress, we talk about finances, but half of being a farmer is preparing for tax season. So it is tax time. And so that encompasses 3 or 4 months out of the year, of course, but it's tax prep time for the actual tax time.
Yeah, we got to do business taxes too, and so that's always a good time. So this year is going to be our first full year with income for our business. So
What?
it's going to be interesting.
Oh,
So
there
I'll
was
have
income involved. You haven't paid me anything, Renee. What are you talking about?
what are you talking about? So it's gonna be pretty funny to figure out what my tax accountant thinks of all of this year. It's gonna be good. All right, so talk to us about this conference. So like kind of walk us through your conference guide. What are some of the topics that they're talking about in Maryland at the Rural Health Association conference?
Yeah, we kind of thought this would be fun, Renee, because remember we did our first podcast on the road, I think in Illinois,
We
right?
did.
And
Hmm.
then we swung down to the University of Alabama. And so it's been kind of interesting to see the differences that I experience as kind of we travel across the country and as we kind of expand outward. It's been an education, because I thought some of those themes would remain the same, and some have, but things are very different in Maryland when it comes to rural health. Does that surprise you at all?
Well, part of me is surprised that there's anything rural in Maryland. Maryland's not that big a state, and there's some pretty good sized cities there. So I'm kind of surprised that there's anything rural. So I was fascinated by the concept that they were having a rural conference. I kind of assumed maybe it was more regional, maybe some of the other small states attend too. Or are you finding it to be mostly just Maryland that's
Most
there?
just Maryland, a little Virginia and West Virginia,
Hmm.
mostly Maryland. I did do a little research before coming here, and corn and soybeans are their two major crops, and broiler chickens. They are very
Oh,
similar to Iowa,
huh.
when it comes to agriculture. And they have a very large immigrant population to support fruits and vegetables that are grown on a lot of those specialty farms, as well as the chicken factories for those broiler chickens. And so there's a lot of crossovers when I think of some of the small communities in Iowa,
Yeah,
have large immigrant populations and kind of struggling through some of the health, needs of those populations. And so in some ways, it's much more similar than I expected it to be. And so it's been a fascinating conversation. I think the big difference is there's a lot of really large health systems here.
hmm.
They really control service delivery and how things come through Medicaid in the state. And although they've merged their bureaus of substance abuse and mental health over the last 5 years, there's still a carve out, from what I can understand, for behavioral health service delivery.
Oh,
Um,
interesting.
so it was very interesting. So there's still a very siloed system, but they're working really hard to make it not seem siloed, but
Yeah.
yet still siloed. And so
So do you
I've
think it's like carved out like we used to be back in the day when we had Magellan who did behavioral health and then healthcare was with everybody else, like
believe
that kind of
so.
carve out?
I believe so. So their healthcare systems all manage care. It's
Yeah,
all privatized, but there's a
right.
separate, and they're going through a transformation right now. They're moving to Caroline's taking it over, that whole population. And so it's been interesting to kind of pick up on conversations. I haven't found someone who could explain to me. The Medicaid director spoke this morning, and I wanted to go grab him because it was a great educational, piece that he gave kind of about what they're doing and where they're going. But I always take that with a grain of salt, because what they say they're doing and what's really actually happening sometimes end up being two separate things. And I've heard that on several occasions already now as I've talked with folks, that
Yeah,
how sometimes when the state says they've done it all and it's
yeah,
acceptable to everyone, then in reality, well, it's only in these three locations and it's not
right.
every.
Well, it's that stars on the map phenomenon we always talk about, right? It always
Absolutely.
looks good when the state puts out the map and says, look, we have these services all over these places. And it could be the one guy who got the one service at that one place at that one time, and that made a star, and nobody else has access. So we know to take that with a grain of salt. But I mean, oftentimes though, if at least they're talking about it, maybe they're trying to cast a vision that that is the plan or the direction they want to go. So that's good that you heard some promising things. So talk to us about that. So how'd you open your day? Did you start with the Medicaid director, or do you have somebody else before that?
No, actually, we started with the Medicaid director and some special projects that came out of Baltimore City, kind of looking at, equitable access to care is really important.
Mhm.
And so we heard a lot about some really innovative strategies that they were doing here, really focusing on social drivers of health. So their Medicaid system is really focusing on housing, looking at the homeless population and those who are unhoused as the primary driver for health and behavioral health.
Hmm.
So it was kind of interesting to hear their perspective. I mean, the data does show that. It's just kind of like at what point upstream do you want to start to intervene? And so this is the first state I've been to where they focused on homelessness as being the driver of everything else. And so I thought that was kind of unique in that, we see Medicaid in other states trying to start intervening upstream in different places.
Right.
Um, and so, I thought that was unique in some ways, and I think beneficial in some ways because they're really looking at the long term of how do we start to move our data in a direction where we can start to see, better health outcomes for the entire population.
All right. So after the Medicaid director, where'd you go next? Or did they come to you, I guess? Were you still in the big
Yeah.
keynote room?
Yeah, we were in the big room there. After that, I went to an open access discussion. I'm looking at my book right now, Renee,
Hmm.
so I can do it. It was called Open Access. And so in some ways I was a little disappointed because it was really about an organization who figured out, and so this is stuff we were talking about back when I was running outpatient clinics. It's really that no wrong door, walk-in clinic type mentality. And so it was really, I guess at some ways when we started out, I thought, well, this system's very mature. They've done a lot of things. And then we kind of went back to this is an organization sharing about how they've created a no wrong door approach, how they can do same day evaluations, how it's increased productivity. I mean, it's all of the right things, right? But again, just on an organizational to organizational level, not really being able to be expanded out. Of course, it could be replicated by other organizations depending on how much information was willing to be shared. But, a helpful session, I guess, if you're an organization, I heard a lot of language of, well, but we don't treat substance abuse, or we can't treat this, which then led to there's duplication in the system. And so it's still not a one-stop shop yet. It's just for a very narrow sliver of the population to get folks in the door for a clinical service only, right? It's still not really looking at all those other support services that we really have to think about in rural areas, because in rural areas, you're not always going to have access to a clinician. So what are we doing for self-help? What other types of things are being developed out? And I was kind of disappointed that really wasn't discussed as we went through that conversation.
Wow. So it could have been like a bigger picture that kind of incorporated more things instead of being kind of so specific.
Yeah, and I think that, in some ways it shows that the system there's so many gaps across the entire system that some areas, depending
Yeah.
on your zip code again, is going to have a better response rate and a better ability to access care than a different zip code. And so
Yeah.
I didn't get a
And
good
yeah,
sense how the state,
if you
yeah,
can't even describe it together as one system, then you know for sure you've got those silos. And so
right.
they just sort of outed themselves that it's not as smooth of a system as they would like to say, just because they couldn't even talk about it across the board. That's kind of
Yeah.
a good giveaway. All right,
Yeah.
so after that one, what happened next?
I facilitated one, which was the best one of the day,
Well,
Renee.
of
And
course it was.
we had a small enough group. We got to go around and introduce ourselves, where everybody was from, and really had a great discussion with some folks who do jail diversion. And so they really had some insights into the system and where telehealth is lagging here in some of those areas. We had some folks from some counties who were there. We had one person who represented all the counties across the state. And so really, really kind of started to grapple with how the counties are kind of positioned against the state, who are kind of positioned against Medicaid, and how all of those things aren't necessarily working together efficiently, especially in those rural areas. And so it was really a lot of fun and really fascinating for me to kind of start to wrap my head around a completely different system And the language was very different here, and I think that's something that's interesting as well, is, what we talk about, what we do isn't really political, but certainly the winds of politics blow through all of the different interactions we have when we're working with a state, or, some of the legislators we work with, in order to talk about what we can move forward. And there's a very different vibe in Maryland. I guess I didn't realize that coming into it, as much as I did. And so it made for a very fascinating conversation.
You're probably feeling like home. They're speaking your language.
I know, kind of. And so a couple of times
I'm glad it's you and not me,
I
because I
know, and a couple of
would
times
have
they
been
looked at me
banging
like,
my head going, what are you talking
you're a
about?
farmer from Iowa. And so it was very interesting at times.
So were they like at least a little confused why a farmer from Iowa was there? I mean, were they just like, was there any curiosity as to what are you doing here in
The
Maryland? Or
Medicaid director started the day sharing about his being in 4-H in West Virginia,
oh,
in a town of 85, and we said the 4-H pledge together as a room. So the expectation was a farmer be here, Renee. So I was in the
okay,
right place. There's no
you're in
question.
the right place. That's
There's no
good.
question
That's
about
good to
that.
be. I would definitely not be in the right place. So that's probably good that it's you, not me.
I
I
mean,
like it. So
if
then
you,
after your session, then you continued on. What else did you get to sit in on a couple more?
I did.
You messaged me about an economist. What was that about? And what did you learn something with an
That
economist?
was over lunch. Yeah, over lunch, an economist shared it. And I think that I do appreciate a conference where the conference organizers connect the realities of the economy with where
Right.
healthcare is going, right? Like,
Yeah.
really put the why behind how states function, of how things get funded, of where Medicaid's going, what the total spend is, why we invest in things, right? You put
Okay.
it, you have an economist come in and kind of share with you, where are we at, as a state. And I really appreciated that. Now, some of it I found kind of funny. But, at the end of the day, it was kind of a nice grounding, right? If we're going to have conversations about budgets and what we're going to need as a state, it does matter if the state's increasing in population or decreasing in population. It does matter,
Yeah.
what
Yep.
sectors are
Us.
thriving and what sectors aren't thriving. And so I
Yep.
do think that's a connection that we often miss when we're going and talking with our legislators, or when we're thinking about new programs, or we're thinking about what we need to implement. We also have to look at the economics of everything going on around us, and who is the population we're serving, and is that population growing, or is it getting older? Is it getting younger? All of those things matter. And so I did appreciate the conversation from The Economist as we did that today. I learned some stuff. I have to admit, I took some notes and everything. So I'm going to bring that back. You might be
That's
surprised. I
cool.
might throw some economic slides in our slide deck for future
Oh, okay.
presentation. Yeah.
All right. Well, spice it up a little. But it is good. I mean, that is actually I guess I wouldn't have guessed that being from a blue state, bringing in the economist. That's kind of more of a red state thing to do. But
Yeah.
it is important because when you're talking about quote universal housing, as an example, or universal anything,
Mhm.
there's a cost to that, right? And you've got to put some perspective on that, plus knowing like the projections of how many more in that
Right.
example unhoused we might have in the future. It matters. And so that really is important to kind of, back to your point, you said earlier, though, the conversation wasn't a big enough picture, but it sounds like this one kind of did go big picture. So,
Well,
it's kind of a nice balance there of looking at big and small.
it's been confusing here because it goes back and forth in different areas that I'm not used to them being disconnected or connected. So it
Mm.
breaks the mold of a lot of the Midwestern work that we've done, because in some ways it's very different, but in some ways it's different in a different way. And so it's been very hard for me to kind of wrap my head around some of the different concepts that have been being thrown around here as I talk to folks.
All right. Did you have any more on the conference, or did we want to go into talking about some themes that you've seen?
Well, one theme, and I'll make the transition for you, Renee, is one of the speakers, one of the healthcare organizations had partnered with an immigrant organization to do increased outreach, and has been very successful. And one of the stories that gentleman told was about, really breaking down to us, if you're not part of the solution, you may be part of the problem. And I think sometimes we see organizations or providers want to do the right thing. And so they start doing something, and they don't realize by jumping in and doing that thing that they might be contributing to the problem. They might be contributing to the confusion. Um,
Yes,
and they might be
yes.
making it worse because we see this all the time. You know, we've called them
Yes.
hero programs in the past. We've called them where one person goes out and says, we have a need, we're going to do it. Well, then they start to mask the real need because then it's not quantifiable because they're using other funds or they got a one-time grant or they found a private funder to go and do that. And then all of a sudden they don't have the money to continue it. So then we have to go and rescue that organization, right? And so it was kind of a neat little story of someone who wanted to go and do response work after an earthquake. I think it was in Haiti. And then all of a sudden somebody asked him, well, do you know anything about what the conditions are there? Do you know what it would be like to go and do that? And if you went to go and do that, would you actually be a rescuer or would you actually be part of the problem and someone that they would need to go rescue? And so that really
What a
stuck,
great question.
it
What a
really,
great question.
really stuck with me, Renee, that how often when we're in systems and people want to do something innovative, does it really contribute to the greater good, even though it feels really good at the time? Or do we really need to be thinking longer term? Do we really need to be thinking more globally about those things?
Yep. I can think of multiple examples of things like that in our state where you were talking about putting the money in to kind of band-aid it. And what happened is then it looked like to the legislature or others who should be funding things that, oh, they have money, right? Especially like through the pandemic where different ARPA dollars came through and whatever from the federal government, right? That became a band-aid to not fund whatever. So general funds across the country stopped funding Medicaid, stopped funding things. So this year we have this big Medicaid cliff in our state that is completely driven by that because we put in monies that were one-time dollars and the state knew, right? They knew, so they used the dollars elsewhere. I think in our state it was more like tax cuts, things like that, which is fine. But now they're going to have to fund the differential. And that's happening globally. It's not just us, it's everywhere. And that's a one example, but there's big ones like that. And so then the legislature is like, well, they have plenty of money. So they don't need additional dollars. So you're masking the true need because you've plugged a hole for a minute and you might miss the entire big picture. I mean, that happens in education, it happens in mental health. And so to have somebody speak it like that, that makes a lot of sense because you end up being a bigger problem. And to your point, then you have to be rescued afterwards because you've created this program you can't sustain and you have these employees that are going to lose a job. And now the legislature or whoever, grantor, has to rescue you to keep you there. That's an amazing analogy. I hadn't thought about it like
It,
that.
it is. And then it followed with this, of how short our memory is when it comes to evaluating data. And so
Hmm.
the question was posed, how many of you followed through with your New Year's resolution goals in 2024?
Does anybody even know what they wrote, what they were?
I know. As we come up on New Year's 2025, I'm like, you're right. And our systems forget data as well. We have
Yes.
to be really critical with ourselves, and so this is, as we spend more time, looking at some of the projects we've had that are moving into the data phase of really
Yeah.
thinking about how do we create sustainable data structures and systems and use that in a
Yep.
way that makes sense and informs us down the road, right? And so there's some things that I heard here that were really good of measuring success in programs. There's also some fluffy measurements going on. And so I always like
Oh.
when there's fluffy measurements being proposed as being, really great. Like, well, we had input from 7 different people and they said 90% of the time. And I'm like, no, but I think that those were two really important takeaways,
Yeah.
of that I heard overall. And I'll leave you on this one.
I wanted to,
Yeah, go ahead.
I was going to say you had one more theme you mentioned, but I'm sure it's a little bit of a different theme was housing.
Mhm.
And we've had that conversation about housing, but remember in a previous state, it was about housing staff to do the work.
Right,
So this time is talking about the actually unhoused persons, right? That need
right.
services. Is that correct?
Well, and,
So
and
it's
it's
still an important theme, but different
yeah, and
directions that come in that housing, right?
well, if you remember, then we just finished the project in Nebraska, and that was really about housing of folks who have been incarcerated or in jail or
Yes,
institutionalized and not
yes.
having safe and affordable housing, right? So it's the same conversation. It's just in that state, they're not talking about housing directly. They're talking about behavioral health,
Yep.
right? They're not actually addressing the real issue, which is safe and stable housing actually has impacts on healthcare, physical healthcare, mental healthcare, food security, like all of the things are connected. And so it was just interesting hearing the approach here of we're going straight at housing and our focus is
Right.
on decreasing those who are unhoused by so many percent in the next 5 years, where the other states have the same issues, but they're not talking about housing.
Right. So what you just mentioned though about how they're this Band-Aid approach that goes after the, some issue that masks the true issue, is that not what we're talking about here? I mean, if your housing is an issue in Nebraska, other Midwestern states, but we're not addressing housing, we're talking about behavioral health, we're talking about incarceration, we're talking about competency to stand trial. We're talking about these other issues when the baseline issue is housing.
Right.
Am I wrong?
And you're not
All
wrong.
right.
You may
That's
be
interesting.
more with Maryland than you know you are, Renee. So we might have to get you out here east yet.
No, they'd probably make me eat crab cakes or something. Can't do it. Nope, nope, nope,
They're
nope,
fantastic.
nope.
They're
All
delicious.
right. Did you have any other themes you wanted to bring up from what you've seen now? Because you're on this conference circuit. I don't even know. Do you know how many conferences you've been to this year? Have you kept a number or track?
I haven't kept a number. I quit counting at 12. So I know I've exceeded 12, and I've lost track of how many states so
All
far.
right. So housing is a theme, and you were going to tell me another one. What is another theme that you've seen?
Oh, I was just going to leave you on this. There's been a focus on partnerships and how do you work
Yeah.
together. I think it's been somewhat siloed here in the conversations. This is something that, we've done a lot of work of bringing community partners together, of getting diverse groups of people together, to really look at how can we help serve folks, especially in rural settings. One analogy that came up here that, again, I'm going to steal this one because I hadn't heard it in this way, or it just kind of resonated with me today, was, when we're doing partner activities, it's kind of like we're all in a car together, and we're driving along, and it just takes one nail in one tire to bring everything to a stop. And so who's responsible for changing that tire? Because if we just get the nail out of the tire and put a plug in it or put the spare tire on, we can get the whole car moving forward again. But how oftentimes do we argue about who should be the one paying for the tire, or who should be the
Mm,
one to change the tire, or someone's
mm.
not able to change the tire on their own because they don't have a wrench with them, or they don't have an impact to be able to change the tire. But if we just got the tire changed, the whole thing could move forward. So,
Right.
I think that's a good takeaway, right? That sometimes we argue about the wrong thing. And how do we
Mhm.
step back and focus, right? So, those are just a few random thoughts from Maryland.
Random thoughts from Maryland. I cannot wait to see a car with tires in our next presentation. I'll see it kind of moving along and then limping along, and I'm sure, steal this analogy, credit
We
the
could,
unnamed person in Maryland.
we need
It'll be,
animation. We need an animation something. We're gonna hire an animator
I can't,
and come up with
I can
something.
see it already in my mind. It's coming. I'm
I
guaranteeing it.
think I could do something.
All right, so the self-care policy of the week for the recovering politician. It's my birthday month. And the
Birthday.
thing about Thank you. Well, one of the things about being my birthday month is that it's a season of joy for me. And it's not always joyful because it's some hard times. This is my first year without my mom. And so it may not be like the easiest time of the year for us, but I'm going to go looking for fun and exciting things to do. So my goal is to have one interesting thing a week through that month, since it is going to be my first anniversary without my mom, so that I can try to keep a joyful outlook and a balance in life. I can't promise there's not going to be any sadness or hard times because we'll all be together at the holidays, and I'm sure there will be. But I think that going into it, I've got that top of mind to kind of look for the good. And I think I'm hoping that that really helps being the first time without her there. So we'll see how it turns out. I might be a hot mess in January, and then you'll have to talk to me about burnout and stress. But between now and then, that's my plan. So what about you? As you head into the holidays, you have any tips or anything for folks that are like thinking about like how to take care of themselves through this season? I know this is always the season you bust out that self-care snowman. What are your
You
thoughts on helping people kind of this time of year?
I do have the self-care snowman out for a couple presentations coming up here over the holiday season. I think it's really comes down to, I'm going to be talking about family communication next week, actually, at another conference as I zip back and forth across the Midwest. And, I think it's a time we need to think about, how can we put aside all those differences over the course of a year and come back together as family and appreciate everyone for who they are. And so I think, if we take that thankful spirit from Thanksgiving into the holidays, and really try to step back and kind of start anew. I think it would be a great opportunity.
Well, before I recap for today, where are we going to be next on our travel adventures for this podcast? Where do you remember where we go next?
I think we're going to be in Kentucky next. Aren't we going to Bowling
Kentucky.
Green? And
I
we are,
think we're both there at the same time, so we can record from the same location next time. That should be a
I
lot of
think
fun.
we're going to do it from the Corvette Museum. Are we not going to do it from the
Oh,
National Corvette Museum in Bowling
I
Green?
have, should I tell you I've already been there once?
Well,
It's a lot of fun.
and
It's
we
pretty
let
cool.
it be the
I hope we
second
get to see
time.
it.
I can already tell
Maybe
you.
that'll be the theme of the entire podcast is the Corvette Museum.
It could be. We could also do one from Nashville. I think we're going to be in Nashville at the same time too. So we could end up on
Oh, we can
way
get near that plowed truck and take some videos and get.
tractor. It's a tractor.
Oh,
So we
I'm
have
sorry. I got plowed tractor. That'll
those.
make it all better. All right, everybody. Well, this week Jason's in Maryland and we're giving you the update on what's going on in the conferences. And we still have some themes that are the same. I'm dropping some things in the show notes. You can see about the conference itself, learn about what kind of things were on their agenda this time around. Also tapped you into the Medicaid director in Maryland and their telehealth system so you can learn how things are the same and different. That's always interesting to us. And I'm giving you a couple of show notes there. And then next time we get together, we'll be chatting with you from the great state of Kentucky. See you all later. Have a great day.